Hi, I'm Dr. Tony Urbanek, and I'd like to tell you about how I came to find and use the medical device that we now use in the practice so successfully to treat temporomandibular joint, jaw joint problems. As a surgeon, as an oral and maxillofacial surgeon practicing for almost 35 years now, I've done well over 2,000 temporomandibular joint surgeries, and over that period of time I was fairly consistent that even though I did my very best, patients would be back in 6 months, a year, 2 years, and they would say, Dr. Urbanek, my pain has returned, and that was very disappointing. So after listening to this for years and years, I decided this problem can't be that complicated. There must be a better solution, certainly a better solution than surgery. So I did something quite unique, I think, in the medical community. I sat down with a number of patients, each one of them simultaneously telling me everything they could tell me about their problem. I opened myself up. I sat there sometimes for 30 minutes, and please tell me everything you can tell me. When does it hurt? Why do you think it hurts? Why your husband think it hurts? And I heard something that was very unique. I heard a lot of things I already knew, but I heard something that really jogged my creativity and my interest in trying to find the solution. And they would say, Dr. Urbanek, if I take a pencil eraser and gently put it between my two front teeth, or my finger and gently put it between my two front teeth, or if I take my tongue and gently put it between my two front teeth, it feels better. I had no idea why that would be, but I went into my lab, made a little device that went between the two front teeth, gave it to the first patient, asked her to come back in 3 weeks, and after she had a history of 40 years of pain, came back and said, my pain is gone. I was quite stunned. Of course, this is not a long-term thing, but I tried it on the second patient, and that patient came back and said the majority of her pain was gone. Maybe not 100%, but 90%. I did this for a dozen patients, and each one came back over a period of time and said their pain was much better or totally gone. All of those symptoms, headache, earache, jaw pain, neck pain, the whole litany. So I use this medical device and the protocol that goes with it. I've modified it somewhat, but it is so unique that it now has a patent pending on it. I have found now, after delivering well over 1,000 of these medical devices over the past 3 years, that the average person will come back at 3 weeks and say 70% of my symptoms are gone. These are average numbers now. At 2 months, they will say 86% of my symptoms, and when we get out to 4 or 5 months, they'll be up to 90 to 100% of their symptoms are gone. After years of treating patients with temporomandibular joint, jaw joint problems, I find that the problem itself ruins a lot of lives. I have had many patients who come in to see me who have had catastrophic problems because of pain originating from their jaw joint, and it's been overlooked or misdiagnosed or not treated. I can give you hundreds of examples, some of them terrible. I mean, patients that have to have gastrectomies because they take so much pain medicine it rots out their stomach. I have one patient who has had to have a liver transplant because she took so much Motrin and couldn't find relief in any other method. So I take this as a personal challenge to disseminate it and bring it to as many people as I can throughout the United States and the world. There's a simple solution to this problem. It is not complicated. It is not surgical. And patients who have the problem, have the proper diagnosis, will benefit with no exception. Hi, I'm Dr. Tony Urbanek, and I hope to see you in my office so that I can help you.